The world faces an invisible enemy. Infectious diseases are rising. They are spreading faster than ever. These diseases know no borders. We are in a new era of outbreaks. This is a pattern. The consequences are dire. Lives are lost. Economies suffer. We must take action now. The world is more interconnected than ever. Travel is faster, trade is global, but it also creates risks. Infectious diseases can spread rapidly. Climate change is fueling the problem. Temperatures are rising. This creates ideal conditions for diseases to thrive. The COVID-19 pandemic was a wake-up call. It exposed the vulnerabilities of our healthcare systems. But we have not learned our lesson. New threats are emerging. Bird flu is spreading rapidly. Fungal infections are becoming more common. Antimicrobial resistance is on the rise. Pandemics could become more frequent. We must act now to prevent this future. The enemy is invisible, silent, and deadly. It lurks in the shadows, waiting for the opportune moment to strike. It is not a single entity, but a multitude of microscopic foes: bacteria, viruses, fungi, and parasites. These pathogens have plagued humanity since the dawn of time. For centuries, infectious diseases were the leading cause of death worldwide. Smallpox, plague, tuberculosis, and influenza ravaged populations. With advancements in sanitation, hygiene, and medicine, we made significant strides in controlling these ancient adversaries. However, our triumph was short-lived. In recent decades, we have witnessed a resurgence of infectious diseases. To understand this growing threat, we must delve into the factors driving this alarming trend. A world in flux, climate change and disease. Our planet is warming, impacting our health. Climate change is a significant driver of the emergence and spread of infectious diseases. As temperatures rise, disease vectors such as mosquitoes, ticks, and fleas are expanding their geographical distribution. Warmer temperatures accelerate the life cycle of these vectors. Extreme weather events such as floods and droughts can create breeding grounds for disease vectors. Heavy rainfall and flooding can contaminate water sources, leading to outbreaks of waterborne diseases. Climate change can also alter the ecology of pathogens. The impact of climate change on infectious diseases is complex and multifaceted. Globalization, a double-edged sword. Globalization has brought numerous benefits but also unprecedented opportunities for the rapid spread of infectious diseases. The ease and speed of modern travel allow pathogens to traverse continents in hours. The global trade network provides avenues for the unintentional transport of pathogens. Foodborne illnesses can be spread through contaminated food products. Disease vectors can hitch a ride on cargo ships and airplanes. The increased movement of people and goods necessitates robust surveillance systems. International organizations play a crucial role in coordinating global health efforts. The human-animal interface, a breeding ground for pandemics. The majority of emerging infectious diseases are zoonotic, meaning they originate in animals and spill over into human populations. The increasing encroachment of human activities into wildlife habitats is contributing to the increased risk of zoonotic disease emergence. Deforestation and habitat fragmentation can displace wildlife, forcing them into closer proximity to humans. The agricultural industry, particularly intensive livestock farming, also poses a risk for zoonotic disease emergence. The wildlife trade is another major contributor to the spread of zoonotic diseases. The capture, transport, and sale of wild animals provide opportunities for pathogens to cross geographical boundaries. The perfect storm, a convergence of threats. The resurgence of infectious diseases is driven by a complex interplay of environmental, social, and economic determinants. Climate change, globalization, and the increasing interconnectedness of human and animal populations have created a perfect storm. Strengthening healthcare systems is crucial to enhance surveillance and improve early detection. Investing in research and development is essential to develop new vaccines and therapeutics. Addressing the root causes of infectious disease emergence will require a paradigm shift. International collaboration and coordinated responses are crucial to effectively address this threat. The shadow of a pandemic, avian influenza returns. The world watched in horror as COVID-19 swept across the globe. Yet another threat looms large: avian influenza, commonly known as bird flu. This highly contagious viral disease primarily affects birds. Certain strains, like the highly pathogenic H5N1, can cause severe illness and death in birds. The true danger of avian influenza lies in its potential to jump the species barrier and infect humans. While human infections are relatively rare, they are often severe with a high mortality rate. The recent surge in H5N1 cases in birds and the detection of the virus in various mammals have raised alarm bells. Continued vigilance and proactive measures are needed to mitigate the risk of a global health crisis. H5N1, a virus on the brink. H5N1, a subtype of the influenza A virus, belongs to a group of highly pathogenic avian influenza (HPAI) viruses. These viruses cause severe illness and high mortality rates in poultry. The H5N1 virus is highly adaptable and constantly evolving. The virus spreads primarily through direct contact between infected birds and contaminated surfaces. Wild birds can carry the virus without showing symptoms, acting as silent spreaders. H5N1 infection in humans typically occurs through close contact with infected birds. The high mortality rate associated with H5N1 infection underscores the need for rapid diagnosis and treatment. The silent spread from poultry to humans. The interface between humans and poultry plays a critical role in the transmission dynamics of avian influenza. Backyard poultry farming is common in many parts of the world, creating ample opportunities for the virus to spill over from birds to humans. Live poultry markets are another major source of H5N1 transmission. The handling of live birds can generate aerosols containing the virus, leading to infection. The consumption of undercooked poultry products can also pose a risk of H5N1 infection. Preventing the spread of H5N1 from poultry to humans requires a multifaceted approach. A race against time, the search for a vaccine. The development of an effective vaccine is considered the most promising strategy for preventing a global avian influenza pandemic. Scientists around the world have been working tirelessly to develop H5N1 vaccines. Several different types of H5N1 vaccines are being developed. One of the main challenges in developing an H5N1 vaccine is the virus's rapid mutation rate. Despite these challenges, several H5N1 vaccines have been developed and approved for use in humans. These vaccines are designed to provide some level of protection in the event of a pandemic. The threat within: H5N1 in the U.S. The highly pathogenic H5N1 virus was first detected in wild birds in the U.S. in 2014. The 2022 to 2023 avian influenza outbreak in the U.S. was the largest and most costly animal health emergency in the country's history. The outbreak affected commercial poultry farms, backyard flocks, and wild bird populations across multiple states. The presence of H5N1 in the U.S. poses a significant threat to the country's poultry industry. The U.S. Department of Agriculture, USDA, and the Centers for Disease Control and Prevention, CDC, are closely monitoring the situation. They are working to prevent the spread of the virus. Section 6. A global challenge containing the spread. Containing the spread of avian influenza, particularly the highly pathogenic H5N1 strain, is a global challenge that requires a coordinated and multifaceted approach involving international organizations, governments, the poultry industry, and the public. International collaboration is crucial for sharing information about outbreaks, monitoring the evolution of the virus, and coordinating control measures. The World Organization for Animal Health, or WOA, formerly known as the OIE, plays a key role in coordinating global efforts to control animal diseases, including avian influenza. Governments play a critical role in implementing effective surveillance systems, enforcing biosecurity measures on poultry farms, and controlling the movement of poultry products. Public awareness campaigns are essential for educating the public about the risks of avian influenza and promoting preventive measures. The poultry industry has a responsibility to implement strict biosecurity measures on farms to prevent the introduction and spread of the virus. Vaccination of poultry can also be an effective control measure, although the availability and efficacy of vaccines can vary. Containing the spread of avian influenza is an ongoing challenge requiring constant vigilance, proactive measures, and a collaborative approach to protect both animal and human health. The silent rise of a hidden enemy. While viruses dominate headlines, a hidden enemy silently gains ground, threatening decades of medical progress. This enemy is fungi, often overlooked. Fungal infections were once easily treatable. Now, drug-resistant fungal infections pose a global health challenge. Section 2, Candida auris, a stealthy killer in our midst. Among the growing list of drug-resistant fungal threats, Candida auris stands out as a particularly formidable foe. First identified in Japan in 2009, this emerging fungal pathogen has rapidly spread across the globe, causing outbreaks in healthcare settings and sounding alarm bells in the medical community. Candida auris is a type of yeast, a single-celled fungus that can cause invasive infections in humans. Unlike other Candida species, which are commonly found on the skin and in the digestive tract of healthy individuals, Candida auris is often resistant to multiple antifungal drugs, making infections difficult to treat. Candida auris infections are particularly dangerous for hospitalized patients, especially those in intensive care units or with weakened immune systems. The fungus can enter the bloodstream through medical devices such as catheters, central lines, or ventilators, leading to invasive candidiasis, a serious and potentially life-threatening condition. One of the most alarming aspects of Candida auris is its ability to spread easily within healthcare facilities. The fungus can survive on surfaces for extended periods, making it difficult to eradicate through routine cleaning and disinfection procedures. Furthermore, Candida auris can colonize the skin of healthcare workers and patients, leading to silent transmission within hospitals and long-term care facilities. Section 3, the challenge of resistance, battling a formidable foe. Drug-resistant Candida auris infections challenge healthcare systems worldwide. Limited antifungal drugs and rising resistance complicate treatment. Resistance to echinocandins is increasing, leaving fewer treatment options. Developing new antifungal drugs is crucial. Strengthening infection control measures and rapid diagnostics are essential. Section 4, TMVIO, a new scourge on the rise. As if battling Candida auris wasn't enough, another fungal threat has emerged, rapidly spreading across the globe and raising concerns among public health officials. Trichophyton mentagrophytes variant interdigital lineage 7, or TMVI for short. This newly identified fungal lineage is responsible for a surge in cases of tinea, a common fungal infection affecting the skin, hair, and nails. Tinea, commonly known as ringworm due to its characteristic ring-shaped rash, is highly contagious and can spread through direct contact with an infected person or animal, or through contact with contaminated objects or surfaces. While not typically life-threatening, tinea can cause significant discomfort and disfigurement, and if left untreated can lead to secondary bacterial infections. What sets TMVIU apart from other tinea-causing fungi is its remarkable resistance to terbinafine, the most commonly prescribed antifungal medication for tinea infections. This resistance poses a significant challenge for treatment, often requiring prolonged or alternative antifungal therapies with potential side effects and higher costs. The reasons behind the rapid spread and turbinifying resistance of TMVI are not fully understood but are thought to be multifactorial, potentially involving a combination of increased international travel, overuse of antifungal medications, and genetic factors within the fungal lineage itself that confer resistance. Section 5. The need for vigilance, strengthening our defenses. The rise of drug-resistant fungal infections such as Candida auris and TMVI serves as a stark reminder of the ever-present threat posed by infectious diseases and the need for constant vigilance in our fight against these microscopic foes. As we grapple with the ongoing COVID-19 pandemic, we must not lose sight of the broader landscape of infectious disease threats, including the often overlooked realm of fungal pathogens. Strengthening our defenses against drug-resistant fungal infections requires a multi-pronged approach, involving efforts from healthcare providers, researchers, policymakers, and the public alike. Enhanced surveillance systems are crucial to track the emergence and spread of drug-resistant fungi, providing early warning signs and guiding targeted interventions. Investing in research and development is paramount to developing new antifungal drugs, diagnostic tools, and vaccines to combat these evolving threats. The development of rapid diagnostic tests can help identify infected individuals quickly, facilitating prompt treatment and preventing further spread. Antimicrobial stewardship programs play a crucial role in optimizing the use of antifungal medications, ensuring that these life-saving drugs are used appropriately and effectively to minimize the emergence of resistance. Public awareness campaigns can educate the public about the importance of preventing fungal infections, recognizing the signs and symptoms of these infections, and seeking prompt medical attention when necessary. Turning the tide, a call to action. The battle against infectious diseases is a perpetual struggle. New threats emerge, testing our limits. The rise of drug-resistant infections and emerging pathogens demand a coordinated response. Complacency is not an option. We must act now to safeguard our planet's health. This is a call to action for a global effort. By harnessing science and human ingenuity, we can overcome these challenges. Strengthening the front lines, empowering healthcare systems. Healthcare systems serve as the front line in our battle against infectious diseases. They are the sentinels that detect outbreaks, the first responders that provide care to the sick, and the guardians that protect communities from the spread of disease. Strengthening healthcare systems, particularly in resource-limited settings, is paramount to enhancing our global capacity to prevent, detect, and respond to infectious disease threats. Investing in healthcare infrastructure, including hospitals, clinics, laboratories, and surveillance systems, is essential to ensure that healthcare services are accessible and equipped to handle the demands of infectious disease outbreaks. This includes ensuring access to essential medications, diagnostics, and medical supplies, particularly in remote and underserved areas. Training and equipping healthcare workers with the knowledge, skills, and resources to effectively diagnose, treat, and prevent infectious diseases is paramount. This includes providing ongoing professional development opportunities, access to the latest medical guidelines, and support for infection control practices. Strengthening public health surveillance systems, both domestically and globally, is crucial to enhance our ability to detect outbreaks early, track the spread of diseases, and guide targeted interventions. This includes investing in laboratory capacity for disease surveillance, data management systems, and the training of epidemiologists and public health professionals. Investing in innovation, the quest for new weapons. The fight against infectious diseases is a perpetual arms race, with scientists and researchers constantly striving to stay one step ahead of evolving pathogens. The COVID-19 pandemic served as a stark reminder of the devastating consequences these microscopic enemies can unleash, exposing the vulnerabilities of even the most advanced healthcare systems. As we emerge from the shadow of this pandemic, we must embrace a renewed sense of urgency in our fight against infectious diseases. The battle against infectious diseases is a relentless arms race against ever-evolving foes. The unpredictable nature of emerging infectious diseases demands a sustained and multifaceted response. The fight against infectious diseases is a shared responsibility that demands the collective action of governments, communities, and individuals worldwide. International collaboration is paramount to sharing information, coordinating surveillance efforts, and developing essential resources. Each of us has a role to play in preventing the spread of infectious diseases. Getting vaccinated not only protects individuals but also contributes to herd immunity. The challenges posed by infectious diseases are formidable, but they are not insurmountable. Advances in science and technology have provided us with unprecedented tools to combat these microscopic foes. The COVID-19 pandemic spurred unprecedented levels of scientific collaboration and innovation, leading to the rapid development of vaccines. The fight against infectious diseases requires sustained investment, unwavering commitment, and the courage to adapt our strategies as new challenges arise. The world stands at a crossroads, facing a future where the threat of infectious diseases looms larger than ever before. The COVID-19 pandemic served as a stark reminder of the devastating consequences these microscopic enemies can unleash, exposing the vulnerabilities of even the most advanced healthcare systems and highlighting the interconnectedness of our globalized world. As we emerge from the shadow of this pandemic, we must not succumb to complacency or fatigue, but rather embrace a renewed sense of urgency in our fight against infectious diseases. The battle against infectious diseases is a perpetual struggle, a relentless arms race against ever-evolving foes. The emergence of drug-resistant pathogens, the spillover of zoonotic diseases from animals to humans, and the unpredictable nature of emerging infectious diseases demand a sustained and multifaceted response. We cannot afford to let our guard down or to assume that past victories guarantee future security. The threats we face are complex and interconnected, requiring a comprehensive and collaborative approach to mitigate their impact. Climate change, globalization, and the increasing encroachment of human activities into wildlife habitats have created a perfect storm for the emergence and spread of infectious diseases. Addressing these underlying drivers of disease emergence is essential to breaking the cycle of outbreaks and building a healthier and more sustainable future. The fight against infectious diseases is not a battle for scientists and healthcare workers alone. It is a shared responsibility that demands the collective action of governments, communities, and individuals worldwide. We must move beyond national borders and embrace a global perspective, recognizing that the health of one is linked to the health of all. International collaboration is paramount to sharing information and coordinating efforts. Developing and distributing essential resources such as vaccines is crucial. Strengthening global health infrastructure ensures equitable access to healthcare. Empowering communities through education fosters a culture of prevention. Public awareness campaigns educate about the risks of infectious diseases. Emphasizing vaccination and dispelling misinformation is vital. Each of us has a role in preventing the spread of infectious diseases. Practicing good hygiene and getting vaccinated protects everyone. The challenges posed by infectious diseases are formidable, but they are not insurmountable. We have overcome similar challenges in the past, and we can do so again. The history of public health is replete with examples of human ingenuity, perseverance, and collaborative spirit triumphing over seemingly insurmountable odds. Advances in science and technology have provided us with unprecedented tools to understand, diagnose, treat, and prevent infectious diseases. From the development of life-saving vaccines and antibiotics to the advent of rapid diagnostic tests and genomic sequencing, we have made remarkable strides in our ability to combat these microscopic foes. The COVID-19 pandemic, while undeniably devastating, also spurred unprecedented levels of scientific collaboration and innovation, leading to the rapid development of safe and effective vaccines in record time. This remarkable achievement serves as a testament to our collective capacity for innovation and a beacon of hope for the future. The fight against infectious diseases is a marathon, not a sprint. It requires sustained investment, unwavering commitment, and the courage to adapt our strategies as new challenges arise. We must remain vigilant, proactive, and adaptable, constantly seeking new knowledge and refining our approaches to stay ahead of evolving threats. The future of our health is inextricably linked to our ability to effectively prevent and control infectious diseases. By embracing a holistic One Health approach that recognizes the interconnectedness of human, animal, and environmental health, we can create a healthier and more sustainable future for all. Investing in education, research, and healthcare infrastructure is not merely an expenditure, but rather an investment in our collective future. By prioritizing public health, we are investing in a world where pandemics are less likely, healthcare systems are more resilient, and people everywhere can live longer, healthier, and more fulfilling lives. The challenges we face are real, but so too is our capacity for innovation, compassion, and collective action. By working together, we can build a future where infectious diseases no longer cast a long shadow over humanity, and where health, well-being, and opportunity are shared by all.